We'll transition now into talking more about additional legal regulations that are important to know as you look for employment in the healthcare sector. The first is the Affordable Care Act. The first component of the Affordable Care Act to note is the Medicaid expansion. Medicaid has been expanded in several states, and basically this expansion means that anyone under 138% of the federal poverty line is eligible for Medicaid insurance, and it removes the requirements for other types of means testing. That is to say that low income status alone qualifies an individual to receive Medicaid. Other key provisions include the establishment of the individual marketplace. We've covered this briefly in the payers component, but the individual marketplace was established in 2010 after the passage of the Affordable Care Act. Before that, it was much less regulated and very difficult for patients to navigate. Now it is much more organized on an online platform that patients can easily navigate. Other components include expansions for care to individuals under the age of 26 so that they can continue to access health insurance through their parents, as well as some other features that we will not cover here. The Covet Cares Act is another regulation that has been recently passed in response to the COVID-19 pandemic. The Covet Cares Act secured funding for hospitals and health systems, as well as for states in their public health efforts to respond to the COVID-19 pandemic. Other regulations to know include Mtala. Mtala requires that emergency departments cannot turn away patients seeking emergency care. COBRA is another important healthcare regulation, and that is a regulation that kicks in when people transition or lose their jobs, and it is designed to help create continuous health insurance access for people through the job transition process. This concludes our overview and introduction to the U.S. health system. I hope you've now learned more about the healthcare system, including payers, providers, and biotechnology, about population health, and some health adjacent sectors. We wish you luck on your journey to finding employment, and we hope that this was helpful as you get oriented to the U.S. health system.